introduce you Dr. James Fitzgerald. Thank you, Dr. Fitzgerald, for being with us, the Director of the Department of Health Systems and Services, PAHO WHO Headquarters, for opening this webinar. So you have 5 minutes, James. Thank you.
Thanks so much, Gabriel. Very good morning to you and a very good morning to all here present. Let me first of all begin by really recognize our distinguished guests this morning, our distinguished speakers, Dr. Terry-Ann Joseph, who's the Deputy Chief Medical Officer at the Ministry of Health and Wellness and the Environment in Antigua and Barbuda, Dr. Jorge Palanco, who's the Director of Hospital Services and Allied Health at the Ministry of Health and Wellness in Belize, and Mr. Dwight Calixte, who is the Chief Health Planner, the Ministry of Health and Wellness and Elderly Affairs in St. Lucia. Many thanks also to our PAHO country representatives who are present here this morning from the Bahamas, Turks and Caicos Islands, Barbados and the Eastern Caribbean countries, Belize and Trinidad, Tobago, and the Dutch entities. And so thank you for joining us for this very important opportunity we have this morning to discuss the strengthening of the essential public health functions in the Caribbean. As Gabrielle mentioned, this is one webinar in a series of webinars on primary health care, but very much focusing on the territorial perspective, the conditions of the territories and the populations living within that context. Through this series, we seek to integrate knowledge and our technical cooperation, but with the experiences of the countries of the region of the Americas at the heart of the discussion. A territorial approach to primary health care is fundamental for the transformation of health systems and to address the needs of all people in the Caribbean where they're actually living. The countries of the Caribbean specifically have made notable progress in the face of important health, economic, and developmental challenges, and are moving forward on a path towards universal access to health and universal health coverage. So this morning, we will hear directly from countries that have implemented an evaluation of the essential public health functions and are taking actions to strengthen those functions. We look forward to hearing from their experiences and really gain insight into how the essential public health functions are being incorporated into processes to strengthen primary healthcare-based systems. But before this, I would really first like to highlight a few key points which provide a basis for our discussions today. The renewed framework for the essential public health functions was actually published in 2020 by PAHO, arising from a changing health landscape within the region and the need to build stronger and more resilient health systems based on primary health care. The framework was further prioritized in the strategy for building resilient health systems and post-pandemic recovery to sustain and protect public health gains that was adopted by all PAHO member states in 2021, highlighting the need for comprehensive primary healthcare approaches. The renewed essential public health functions, with its conceptual and methodological framework and innovative tools, really provides a comprehensive framework for the strengthening and the development of resilient health systems, presenting 11 essential functions across a policy cycle, noting the importance of evaluation, policy development, resource allocation, and really access to services. Most recently, a strategy for strengthening the essential public health functions to accelerate health systems transformation was approved by our member states during the 174th Executive Committee in June of this year. This strategy provides a framework to support member state actions in strengthening essential public health functions, not just at the national level, but also the subnational and local level, with the objective of accelerating health systems transformation and addressing emerging public health challenges. So within the context of the Caribbean really has demonstrated strong leadership and commitment to these processes and in the implementation of the functions. 9 countries have completed the essential public health functions evaluations, which aim to address those capacities and identify areas for improvement and subsequent investment. These evaluations have led to the creation of strategic action plans, which will serve to support the development of national health policies and plans. And so it's really truly commendable to see so many countries in the Caribbean making significant strides in strengthening public health capacities, even amidst challenging circumstances. But by working together, countries in the Caribbean are not only strengthening public health, but also fostering cooperation among those countries to share best practices and resources. And so in concluding, we really hope that today's discussion and reflection will motivate each of us in our respective roles to continue to strengthen public health capacities in countries. By doing so, we contribute to the strengthening of all health systems, ultimately protecting rights, health, and the well-being of every individual in our region. Thank you very much for joining us, and I wish you a very productive and insightful webinar. Back to you, Gabriel.
Thank you, James. Thank you for these words and giving some background of this relevant topic. So now I'm pleased to introduce Natalia Houghton, who is our Technical Officer in Primary Healthcare, Policy Planning and Evaluation within the Primary Healthcare and Integrated Service Delivery Unit, PAHO WHO Headquarters. Natalia, the floor is yours for the next 10 minutes. Thank you.
Thank you so much, Gabriel, and I'm really excited and honored really to be able to give this presentation on the experience of the Caribbean countries in the implementation of the renewed approach of the essential public health functions. I have 10 minutes allocated, so I'm just going to provide a general overview of what this experience has been to really give the floor to the countries, our PWRs, to really speak in detail of what this experience has been and what they are doing to move forward towards the implementation and strengthening of the essential public health functions. As James was mentioning, in 2020, PAHO, in collaboration with our member states, published the renewed framework on the essential public health functions as a result of the changes in the landscape in public health and our health systems, and also different commitments and mandates that we as an organization received from our member states that put a priority on the need of strengthening stewardship and governance through a renewed implementation of the essential public health functions. And what you see here is the result of that framework that aggregates 11 functions in a group of 4 phases of policy development, or a policy cycle that includes EPHFs that have to do with assessment, with policy development, with resource allocation and access. And this framework, that encompasses the 11 essential public health functions, was also produced in combination with a toolkit that countries across the region have been using to evaluate the capacities that they have for implementation of the essential public health functions, but also to formulate different strategies and plans for strengthening those functions. So it's really an assessment and strategic planning tool that countries have been using, and in particular in the Caribbean, countries have been using for strengthening capacities. The way they have gone about the implementation of the EPHF renew approach encompasses different phases that have been, used and adapted by the countries. And I'm pretty sure we're going to be hearing about how countries in the Caribbean have adapted this methodology for their implementation in their national context. But overall, what is important to recognize here is that these exercises have been organized by ministries of health and different key stakeholders within the country that come together and define what is going to be the scope of this exercise, who they want to invite for the measurement, for the assessments that they conduct, and how they go about implementation, the formulation and implementation of the plans. So the approach includes 2 phases that have to do with conducting a diagnosis of what are the situation of the health system, an institutional mapping that looks into what are the different stakeholders or institutions that are in charge of implementing the EPHFs in the country, in combination with a phase that includes the measurement of institutional capacities. Essentially, countries use a tool that is available in an online platform when they embark on this exercise through participatory workshops to really assess what are the capacities that they have for implementation of the EPHF. And the results of these 2 combined assessments then inform, as I was saying, the formulation of a strategic action plan for strengthening the EPHF, which in many instances then is used for the development of national health plans or strategies by countries. So in the Caribbean in particular, we have seen widespread implementation of the EPHF. We have had countries like Antigua, Barbuda, the Bahamas, Belize, the Dominican Republic, Jamaica, St. Lucia, St. Kitts and Nevis, Suriname, and Trinidad and Tobago completing all phases of this exercise, which means health authorities, in collaboration with our PAHO country offices, have implemented different types of assessments of institutional mappings of capacities that exist, and then have gone into formulating action plans for strengthening the EPHF and are now, moving in the direction of implementing those actions, which I'm pretty sure we're going to hear from our panelists very shortly. The other thing I think is important to highlight from the experience in the Caribbean is how the implementation of the EPHF has informed not only these exercises in the Caribbean, but for the entire Americas region. We started the pilot testing of these tools in the Bahamas in particular, and through that exercise, we were actually able to introduce very important changes in the methodology and the tools that countries are now using, including the reduction of questions in the questionnaire and the refining of the different tools in the platform that now is being used by different countries. So we're really appreciative of what this experience has been and all the feedback that we have received from the countries during the implementation of the EPHF. The same can be said about the other countries, including in ECC, where multiple adaptations were included to streamline the process, to have or to keep into consideration the fact that we have, stakeholders, officials within the ministries of health that wear different hats, have multiple responsibilities, commitments that can put sometimes difficulties in the implementation of an assessment tool. Therefore, there were multiple modifications that were introduced in order to streamline the process of implementation. The same can be said in Jamaica and Belize, where multiple modifications were also included. And more importantly, I think in all cases in the Caribbean has been the rich involvement of the ministries of health as focal points and as leaders, I think, of the implementation of these exercises. So what results have we seen so far from the implementation of the different phases that I was talking about? I think when we look at the situation analysis, one thing that I can highlight as a general overview of the health systems is the diversity that we see in the configuration of the health systems in their architecture. Is something that we talk about a lot when we are thinking of the Americas as a region, but that we also see in the Caribbean as well, where we see that our health systems, within the Caribbean can have configurations where there is an important participation of the private sector in some instances. There is also a mix of public-private models. There is also some degree of decentralization that we see in some countries, different levels of segmentation as well, all of which, introduces important considerations and challenges too when we're thinking about how countries and how health authorities in particular can coordinate different stakeholders for the implementation of the essential public health functions. So it's important to keep this into consideration and recognize that in the Caribbean, as in other countries in the Americas, we do see the same type of challenges and complexities in the structure and architecture of the health systems. We have also able to recognize important priorities. Again, this is as an overview because I'm very sure that when we hear from countries, we're going to have specific priorities for those countries that may differ from these. But as a general overview, there is an important emphasis on sustainable financing across countries. Non-communicable diseases, tackling this issue is a key priority, as well as specialty medical care. The need for updated data systems and strengthening monitoring and evaluation systems, as well as a stronger social participation in health and multisectoral actions and policies. Those just to provide examples of things that countries have been able to identify and prioritize as part of these exercises. When we look at institutional mapping, we also, again, see a diversity in terms of the different stakeholders that participate in the implementation of the essential public health functions, some belonging to the health sector, some being extra-sectorial and also having different levels of alignment with the health authorities and also different levels of influence that health authorities have over those institutions. We were thinking again on a coordinated implementation of the essential public health functions. And then again, the picture changes a little bit, right? So when we're looking at the aggregate levels for all the essential public health functions, for example, we see lower levels of alignments and influence when we're thinking of private institutions that are outside the health sector, and we're looking at social security institutions within the health sector, but the landscape changes when we're looking at the specific EPHFs, for example, in EPHF 3, which has to do with research, in which we have, highest levels of influence and alignment, for example, within civil society and centralized institutions that belong to the health sector compared to extra-sectoral institutions that belong to the private and civil society. Again, this is a general overview because the landscape and the realities differ, between countries, and hopefully we will hear about that as well. So the last finding to highlight, I think, is what we have seen in terms of existing capacities for implementing the essential public health functions. We talk a lot about capacities when we're speaking about these assessments, and what we mean by that is, looking at formal.
We need to wrap up, please. Thank you.
Thank you, Gabriel. Yeah, we're looking at formal, structural, supervisory, and performance capacities, and we see different levels, of existing capacities within that, with some EPHF having, higher levels of capacities in place. For example, for EPHF2, that has to do with surveillance in comparison for other essential public health functions. But I think what is important to highlight is that as a result of all of those assessments, countries in the Caribbean have been able to identify specific priorities that then they include as part of the national health plans and as part of the actions that they then implement. Again, I'm not going to go into the details because of time constraint, and also because we're going to be hearing about them from our panelists. Also, to highlight the other way in which countries have been engaging for strengthening the essential public health functions has to do with the Economic and Health Dialogue of the Americas, which has a work stream that has to do with prioritization of the health sector transformation, with a focus on essential public health functions, and in which the Bahamas is the country lead. And now we have 17 countries engaged in identifying and establishing shared priorities for addressing institutional gaps that will require future investments. My final slides, just to mention about the approval of the strategy for strengthening the essential public health functions to accelerate health systems transformation during the Executive Committee in June of this year, and which will be presented again for the Directing Council in September. It has 3 strategic lines of action. And all I want to say is that during the interventions of our panelists, I think we're going to be hearing on how these countries are moving the needle in the direction of implementation of these 3 lines of action, which has to do with the strengthening leadership, stewardship, and governance, strengthening the capacity to evaluate the essential public health functions, and then using those findings for decision making, and then strengthening public health workforce competencies for effective implementation of the essential public health functions. Thank you so much, and I'm sorry for the extra time. Back to you, Gabriel.
Thank you, Natalia, for that very informative presentation, and very looking forward to see that presentation of the resolution in the next Directing Council. So for your information, we have shared the links to the documents mentioned in the presentation in the chat, so that you have an opportunity to review them later and share them with your teams and other networks. So now we'll move to the discussion panel. So we have narrowed the focus of the event to countries of the Caribbean to highlight the importance progress being made and to encourage the identification of strategic actions and investments priorities to enhance public health capacities and resilience in the region. We have prepared several questions to guide our discussions with our panelists, whom we thank you again for having accepted our invitation. So we are pleased to have representatives from the National Health Authority of 3 Caribbean countries to have implemented the EPHF evaluation already. So I appreciate if you can open your cameras. We have Dr. Jorge Polanco, Director of Hospital Services and Allied Health, Ministry of Health and Wellness from Belize. Welcome, Dr. Polanco. Dr. Terry Ann Joseph, Deputy Chief Medical Officer, Ministry of Health, Wellness and Environment from Antigua and Barbuda. And Mr. Dwight Calixte, Chief Health Planner, Ministry of Health, Wellness and Elderly Affairs from St. Lucia. So you're very welcome to participate in this panel. We are also pleased to have the presence of my colleagues from the country offices, Dr. Eldona Boisson, Bajo WHO representative from the Bahamas and the Turks and Caicos Islands, Dr. Amalia Del Riego, Bajo WHO representative for Barbados and the Eastern Caribbean countries, and we have Dr. Robert Ward, Bajo WHO Health Systems and Services Advisors from Belize. So thank you all. So we're going to start with our questions, and we're going to start first with you, Mr. Calixte, St. Lucia. So I'm going to pose a question, so you have 5 minutes to answer. So the question is, based on the EPHF evaluation results, what are the specific challenges and opportunities for strengthening public health capacities in St. Lucia? The floor is yours.
Good morning, all. With respect to the question, maybe I could give a full comprehensive approach and try to keep it within the 5 minutes. So with respect to St. Lucia, let's hold on. Okay. With respect to St. Lucia, there was limited human resources across the sector for the EPHF, which was one of the challenges that we had. It have been identified as a significant barrier, making it difficult to maintain adequate staffing levels during the assessments. Given that the same persons who we were accessing to provide the particular guidance and information were also those persons who would have provided the services, the continued services for the ministry. It became difficult to do the extensive discussions that was required to provide the information. So the staffing levels during the assessment and implementing the robust public health strategies, due to the limitation of the human resources, it requires a very sensitive balance between time, given the methodology of the EPHF, versus quality. So therefore, we have to make sure that the services continue and that we have adequate information so that we could plug into the tools that we were using. So it was necessary to balance this. This is one of the challenges that we definitely had. Okay, so hence in the implementation, there is more undocumented time and maneuvering approaches to efficiently achieve the desired outcome. Okay, one of the other challenges that we definitely had was, while there is a strong capacity for data collection and management and analysis through our own health information system, there is a gap in the reporting and dissemination of the information in a timely manner for monitoring the public health trends. But we looked at this as coming out of the assessment, we look at this as some opportunities, getting some opportunities. We look at it as looking at the improving the the intersectoral collaboration. The methodology in itself, although it was, there were challenges, but ultimately there were opportunities in intersectoral collaboration. So St. Lucia would have been able to leverage on its partners between the different sectors. Example, health, education, agriculture, labor, justice, equity, and commerce. All right, so to address social determinants of health and improve the public health outcomes. So the collaborative efforts coming out of the entire process can lead to more integrated and effective public health initiatives where all sectors contribute with respect to accountability. So ultimately, we had to tailor, with these challenges, we had to tailor the EPHF methodology to fit our specific public health content and model, focusing on areas most relevant to the population's health needs. In our approach to tailoring the public health strategies, we had to look at specific epidemiological and sociological contexts, highlighting the importance of customizing the intervention to address our unique needs in St. Lucia. This was done by conducting thorough situation analysis and institutional mappings to identify our health priorities. So these health priorities range from NCDs, mental health, UHC, HRH management, monitoring and evaluation, and reporting. It also looked at barriers to access and equity, violence and injury, and fairly recently added to our ministry, elderly care services. So
Mr.
what
Calix,
we did,
sorry, we need to wrap up this question so I can pose the second one for you. Sorry about that.
all right. So, but then again, that's it. So you could go ahead and issue the second question.
Okay, thank you, Mr. Calix, and apologies for
That's all right.
Okay, so the second question is in the presentation that Natalia just did. She noted the importance of the adaptation of the EPHF evaluation framework to the country context. So how was St. Lucia able to adapt and streamline the EPHF evaluation and strengthening process? Thank you.
Well, maybe I started answering the question before you posed it. My apologies. The idea was that we had to adapt it to fit our own unique experiences. All right, so as I indicated, we had to look at adapting the methodology itself, given some of the challenges that we had with respect to HRH and personnel. We had to adapt the methodology so that it would focus and identify on the areas that we wanted to strategically move with. So as I indicated before, we had to look at mental health, universal health coverage, and so on. All of these were prioritized. And the methodology that we utilized was adapted so that we could draw out the information so that strategically, that as we move ahead towards the development of our own strategic plans for the Ministry of Health and the health sector within St. Lucia, we had to ensure that the tools used would define the information that we would need to make those decisions. So we had to be flexible in terms of the public health planning. So St. Lucia's ability to adapt the EPHF methodologies to the local context shows that the rigid frameworks may need to be adjusted to be effective in different contexts. So therefore, you adjust it to suit your own context to make sure that the tools used is relevant to you and the information can be utilized to ensure that you have the outcomes that you require. We also looked at prioritizing, as I said, the interventions that have the most significant potential impact on the public health outcomes, so as to ensure that the resources are used efficiently and effectively. Thank you.
Thank you very much, Mr. Calix, for giving your inputs of your experience in St. Lucia, and you gave us some challenges and some, opportunities of the implementation, and also very important how the tool was adapted and being very flexible to the needs of the health sector in St. Lucia. So we're going to proceed with our second panelist, Dr. Jorge Polanco. So again, we have two questions for you. The first question, Dr. Polanco, is based on the results of Belize's EPHF evaluation. What are the main investment priorities for enhancing EPHF capacities, and how are these priorities aligned with the current updating of the Belize National Strategic Health Plan? You have 5 minutes. The floor is yours.
Yes, thanks very much. Indeed, we had the assessment done over the last 12 months, and this assessment was also accompanied and complemented by a work plan, a 5-year work plan for us as a country to move in the direction of implementing and addressing those gaps identified there. What I could say is that we have identified areas that we gave priority within the essential public health functions. I will just mention 4 or 5 because, of course, there are different levels of priority and different levels of achievements in regards to these. But, for example, I will mention the one that we as a ministry and even at the policy level keep pointing out is the issue of accessible access to interventions that seek to promote and reduce risk factors and promote healthy behaviors. I'll come back to this. I'll just mention the other 3. Management and promotion of interventions on the social determinants of health. We are all convinced that this issue of addressing social determinants of health is fundamental. That has to be a part of that foundation of interventions. Of course, also the issue of efficient and equitable health financing, and the last 2, development of human resources, which is critical, and the monitoring and evaluation of health and well-being, equity, social determinants, and health systems, performance, and impact. I mentioned it last, but actually this is something that we have been discussing for the recent months very, very frequently. And the reason why we bring this up is because at the same time, we are in the process of, or we have started a process of developing another health sector strategic plan. PAHO WHO here in Belize is assisting us. We are also, over the recent weeks, been discussing on almost a daily basis the need to define very specific indicators for the regional management team and for the operational teams at local level. We say this because our staff is always busy. However, we believe, personally I believe, and at the level of the headquarters, we believe that we could do much more as a country with what we have. We come to the conclusion that it's a matter of seeing how efficient we are and how effective we are. But in order for us to be able to put a grip on this process, we need to have very clearly the indicators that we will use to monitor the delivery of health services at all levels. So this is something that we have been working, and parallel to the development of the strategic plan, we are working on this area. The investment in regards to the question will be part of the overall budget that the Ministry of Finance gives us on a yearly basis. And this will be done through parallel to the strategic plan, which will be a 10-year plan. We have started to work on an operational plan for the next 2 years. So what we have had as part of the agenda.
Dr. Polanco, I think that's your second question, if I'm not wrong.
Sorry?
I think it's your second question that I have for you about finance.
Okay.
So let me pose your second question if
Yes.
you agree. Okay. So in what ways can collaboration with ministries of finance enhance the incorporation of the EPHF into health system strengthening efforts? I think you were talking about financing already. So
Yes. Yeah.
okay, thank you.
Yeah, this, of course, the sustainability of financing is, of course, crucial. We can share that recently in Belize, we expanded what we call the national health insurance. Originally, it was in the south side of Belize City and in the southern part of the country. And over the recent months, it extended to the north, and approval has been given that it will be extended to the west. I mention this because this is a structure that complements primary care services that the Ministry of Health cannot do because of perhaps limited resources or or limited facilities. So then this scheme involves the incorporation or partnership with the private sector, which I think is extremely good, and it has been of much benefit. So here we have the private sector participating, providing primary care, complementing that primary care that we as a ministry have the responsibility to provide. The financing, it's a parallel source. The financing for the National Health Insurance comes directly from the Ministry of Finance. Actually, the National Health Insurance Office falls under the Ministry of Finance. So I mentioned this because the challenge now as a ministry is for us to be able to ensure that we are not duplicating. We know there could be areas of overlap, but coming back to what I said at the very beginning, our challenge is to ensure that we are efficient. So then even the National Health Insurance Scheme is currently being reviewed with that. That is one of the objectives of this assessment, to ensure that the duplication is minimal, thus being able to spend the funds wisely. In regards to, let us say, human resources as another example, the Ministry of Finance would generally, or I would say always, respond to our requests for the recruitment of specialists, let us say, from Central America or from abroad. It's a known fact that healthcare professionals are very limited in Belize, and parallel to that, we have an increasing demand of services in quantity and in quality. So we have had to complement that human resource service by recruiting people from abroad, and the Ministry of Finance has never said no. Once we could justify it, we get. The challenge is not necessarily getting the finance. The challenge is identifying those persons who are willing to come to Belize. So that is just another example in regards to human resources and the support we have had from the Ministry of Finance. I must say that I want to make reference to the intersectoral collaboration, whereby the Ministry of Finance is involved with all the government ministries with whom we need to work. We have had very good experience with the Ministry of Agriculture and the Ministry of Education in implementing activities that need to be done as a group. And we do get the funds very easily from the Ministry of Finance, if it will be in the form of a project, or if there is a need to top up an existing line item within different line ministries, we really don't have problems with that. I should mention also that these requests, depending on the level of the money, the amount of the money, would go through the cabinet, and our minister has always been very supportive in strengthening intersectoral cooperation, in promoting the health and health policies, and especially when it comes to all those interventions that are related to addressing NCD and the social determinants. He is always supported at the level of cabinet, and the finance would always come to, I won't say our rescue, but would always address our requests. I could leave it there.
Okay.
I don't know if
Thank you, Dr. Polanco. Yes, I think it was a very comprehensive answers. And I want to highlight from your priorities the importance of having a monitoring and evaluation system actually to be able to measure your performance and impact of the different interventions, and also the interaction with the Ministry of Finance and having the necessary sources to, to be able to implement, and what you said, avoid duplication. Very important. So thank you for that, Dr. Polanco. So we're gonna go through with our third panelist, Dr. Terry Ann Joseph from Antigua and Barbuda. So again, you have 2 questions, each answer 5 minutes. Dr. Ann Joseph. So the first question, Dr. Joseph, how is Antigua and Barbuda using the EPHF evaluation results to inform ongoing health systems transformation initiatives? The floor is yours.
Thank you. I first of all want to thank you for the invitation for Antigua and Barbuda to speak. And I'd also like to thank Mr. James Fitzgerald for his kind words. Clearly, the assessment, is valuable, especially for Antigua and Barbuda, because it helps us to evaluate, well, it helped us to evaluate our public health system. And it highlighted our strengths and our weaknesses and areas for improvement. And I feel that, we really need to take the opportunity to thank the Pan American Health Organization for really pushing us into having this assessment done, because ultimately we want to strengthen our health system. But before we can even do that, we have to take a good, hard, cold look on where we are, so that we can identify our strengths, our weaknesses, what we need to work on, what we need to strengthen, what we're doing well, and what we could do better. Having said that, particularly for us, this evaluation will help us to develop a more resilient health system, a more responsive health system, one that is adaptable and can efficiently address current and future challenges, such as non-communicable diseases and infectious disease outbreaks. How this evaluation, how is Antigua really using this? Antigua and Barbuda will now update its National Health Strategic Plan. And the idea was to use the results from the assessment of the essential public health functions to inform what our strategic goals would be. And we realized that one of the areas that we really need to strengthen is health financing in general, but we also need to strengthen primary health care and health financing within primary health care, human resources for health within primary health care, and also strengthening our integrated health service delivery networks. And we wanted to strengthen those 2 areas in particular because it will form the foundation for being able to achieve universal health access and universal health coverage. I note that Natalia Houghton mentioned in her presentation that Antigua wants to convert the medical benefit scheme into a national health insurance. And for those of you who don't know what the medical benefit scheme is, it's kind of functions like a quasi-insurance, but it's also a function of public health. It provides meds for persons who have non-communicable diseases, and it also provides some sort of assistance for persons who really need certain interventions that may or may not be accessible in the country, but they may not have the resources so to do. And medical benefit scheme really gets its resources from a tax from everyone. So just to let you know that. And the idea is to convert that into a national health insurance to expand on what we already have. And this certainly would be another way for us, or another path for us to take towards achieving universal access and universal health coverage. We also realize that 50% of the actors that we need in being able to flesh out or implement the essential public health functions is actually in the health system, the government system itself. And so we're trying to see how can we better integrate, how can we better have, foster relationships between these partners in order for us to be able to, implement the essential public health functions. Another area of concern for us is the fact that we realize we need to strengthen our legal framework. If we really want to get things done, we have to have good policies in place. We have to have legislation in place. We have to have regulations in place. And while some may be in place, it may need to be updated. And excuse me. And of course, we have to enact others that may not have been there. And clearly, this will, provide the base that we need to be able to better respond to health emergencies and to improve overall health outcomes. I think, just lastly, because it seems like I have a little bit more time, I think also we cannot underestimate the importance of digital health transformation. Once we advance our digital infrastructure, it's going to support or enhance our data management. And we know that data is needed for us to be able to, see what's happening, for us to be able to prioritize, for us to be able to, allocate our resources adequately, for us to see disease trends, So that's another area. I know that we've begun to do that, but I think the assessment really highlighted that that's something that we need to, implement in fast order. And it also aligns with the government's agenda of digital transformation on a whole.
I think, Dr. Joseph, just about time to give you the second question. Do you agree? So
Yes.
the EPHF approach not only strengthens public health, but also fosters cooperation among countries to share best practices and resources. So how can the Eastern Caribbean countries leverage their unique regional characteristics and resources to facilitate the implementation of the EPHF? So you have 5 more minutes. Thank you.
Thank you. I think that's a particularly interesting question because the foundation already exists. I would say we have OECS, we have CARICOM, we have the Caribbean Public Health Agency, CAFA, and all of these systems are in place to foster regional collaboration. I think if we were to build on that foundation and strengthen these relationships, we are able to share resources, we are able to share expertise, we're able to share best practices, and this undoubtedly will be instrumental in the implementation for collective implementation of the essential public health functions across the region. So, we can take into consideration things like shared surveillance systems, coordinated training programs, joint public health campaigns. And in the context of joint public health campaigns, there are some countries that have, I would say, cultural similarities. So from the outside, I would say maybe Dominica and St. Lucia may have, similarities when it comes to culture. Certainly, they both speak Patois. And if we're looking at public health campaigns, they could do this together as well, share their resources, have one campaign that, would serve both countries. There's also the...
sorry, Dr. Joseph, I think we need to wrap up.
Oh,
sorry.
Well, I'll just say this, just 2 things. Shared public health resources. So there's the OECS PPS, and we know that we get meds through the OECS PPS, but now we can think about somehow broadening that to include laboratory supplies and probably other medical technologies. But before I hand the mic over to you, I really just want to again thank the Pan American Health Organization for its support. They have supported Antigua and Barbuda for many years. And I want to particularly thank PWR Dr. Amalia Del Riego and her team, specifically Dr. Patterson, who's the HSS advisor, for their support. And I look forward to, strengthening the relationship, our working relationship. Thank you.
Excellent, Dr. Joseph, and thank you for your comments and for enriching this discussion of the implementation of the EPHF and the experience that we had in Antigua and Barbuda. So we're short of time, so we're gonna move on to the intervention of our colleagues from PAHO country offices, Dr. Del Riego, Dr. Boisson, and Dr. Bort. So I will pose the question to the group. You will each have 5 minutes to respond. The question is, what is the main technical collaboration from PAHO to enhance the country's capacity to implement the EPHF? And how does the implementation of the EPHF evaluation and strengthening exercise informs the PAHO's country cooperation strategy? So we're going to start with my colleague Amalia de Riego, PWR in Barbados and Eastern Caribbean countries. You have 5 minutes.
Thank you, Gabriel. I think I was the last in the order, but it's okay. First, allow me to congratulate the panelists for excellent presentations. It make our life easier. I have to say that in terms of the essential public health functions as a really powerful framework and tool to support the technical cooperation in the countries, I would like to acknowledge one element that was very clear in the different presentations. These processes are really trying to impact the transformation, health systems transformations based on primary health care. Those transformations are very complex. I don't know any of our countries that will not have a very strong political commitment towards advancing to universal access to health and universal health coverage. The challenge for these small island developing states is not in terms of the commitment, it's in terms of the how to advance with processes that are sustainable in contexts that are very complex. The vulnerability that exists for all of them. In one hurricane season, the whole health system can be wiped out. And also the challenge that was very well expressed in terms of the existing human resources capacities. So in that context, the tool, the framework of the essential public health functions is powerful because can facilitate country processes that otherwise may not be happening. The issue of intersectorial collaboration, the issue of national dialogue to actually explore different avenues. Now, for us, that have been linked to very clear processes of developing and updating national strategic plans and national strategies for health. And I think that's a major contribution. Second, maybe how that helps us in the CCS, the country cooperation strategies. Of course, all of this is our input to inform our cooperation strategy. And we can see that not only at the moment with the future review of the country cooperation strategies, but the process of developing the PAHO strategic plan right now. This analysis, we are already incorporating in that process. And I think I will leave it there, Gabriel. I'm happy to be with all of you and the HSS team. And thank you, everybody, for excellent collaboration in this area.
Thank you, Amalia, for your responses. And in the interest of time, we're going to go with Dr. Boson. Eldona, the floor is yours.
Thank you, and good morning, everybody. Thanks for the presentations from the countries, which Amalia said actually makes our job easier. Greetings to everybody. The first thing I'd really like to do, though, is to acknowledge the Bahamas. They were indeed the first country, as I think Natalia mentioned, in the Caribbean to implement the EPHF assessment. And they learned a lot of valuable lessons as to how they could apply the framework for how we could apply the framework for future evaluations in other countries. So, I really want to take the opportunity at the start of this brief intervention to express appreciation to the government of the Bahamas, especially the Ministry of Health and Wellness, for participating and being eager participants in this process. Regrettably, they're not able to be here today because they have some other previous engagements, but believe me, they've been fully committed to the process and are to the steps that follow. So this assessment really for the country identified gaps, about 6 or 7 gaps for each of the 11 functions that then led to the development of strategies to address the gaps. It concluded last year, and it's providing a lot of good information for an initiative that the country is currently undertaking to strengthen the health system of the country. This initiative, this health system strengthening initiative has 7 work streams and covers all aspects of health system strengthening. And the assessment, the EPHF assessment, has really been the basis for developing evidence-based national strategies. It also has been serving as a guide or a means that will be able to support the country cooperation strategy for the Bahamas. There's a focus on strengthening, in particular, governance and stewardship, so that the Bahamas will evolve into a more effective structure with a strong policy landscape and institutional framework, as well as have processes for good governance in health. Some of the other key means by which this EPHF assessment process is strengthening the health system in the Bahamas includes in the areas of human resources for health by providing information for the establishment of a multi-sectoral national plan for human resources for health. In advancing efforts to ensure a more robust regulatory mechanism to oversee safety, quality, efficiency of medicines and other health technologies, for developing new legislation for pharmaceutical regulation in the country. So, wrapping up, because I know time is very tight, this EPHF assessment process has really served as an important tool for strategic planning in health. It has also served as an important tool to optimize the way we, PAHO, provide technical cooperation to the country. And it really was a tremendous success because of the extent of stakeholder engagement that we had. Very wide, very wide. And also the leadership shown by the Ministry of Health and Wellness of the country. So in conclusion, I really once again commend the Bahamian government and thank them for their meaningful contribution to use the EPHF framework to assess the health system and to use it to develop national health strategies. Thank you, Gabriel.
Thank you, Aldona. Very happy to hear that everything is moving forward. Something that I actually participated personally. So we're gonna go ahead with Dr. Board. 5 minutes.
Yes, thank you very much. Thank you for the opportunity of being here this morning. As for the question about how the essential public health functions are being put together with the country cooperation strategy, well, the current country cooperation strategy in Belize runs from 2023 to 2027. And there are 7 strategic priorities that have been identified with 23 focus areas that can easily be recognized within one or more of the essential public functions that need to be addressed. This exercise is also being used at the core of the structuring process that we are having with the Ministry of Health, structuring the National Strategic Health Plan for the period 25-34. That is a 10-year lifespan. So what we have been thinking, it's a very good option to outline within this conceptual framework of the Strategic Health Plan 3 outcomes that have to do with strengthening the stewardship of the Ministry of Health, strengthening the governance of the whole health system and all the stakeholders and actors involved, and thirdly, improving the health status of people, family, and the community. And so then that's where the essential public health functions are grouped in these 4 areas, are very useful in terms of providing specific outputs in order to achieve these outcomes. And this is the proposal that we are working with the ministry and we will be presenting soon. Really the conceptual framework and the result of the exercise that had been done in 2023 are proving to be very useful in terms of showing us the path of the next 10 years within this strategic health plan. Yes, that would be in short, how useful the essential public health functions are being both for the strategic health plan, but also within the country cooperation strategy here in Belize.
Okay, thank you, Dr. Ward, and thanks to all our panelists for these important contributions. So before moving on with this closing section, we would like to remind you that the recording of this event is being recorded, as well the presentation and other material will be on the webpage dedicated to the series. We will share the link with you in the chat. Now, to provide the final reflections and to enrich this discussion, so I turn to Dr. Ernesto Bascolo, Unit Chief of the Primary Healthcare and Integrated Service Delivery Unit, Bajo WHO Headquarters. So the floor is yours to your closing remarks. Thank you, Ernesto.
Thank you, Dr. Rivas, for your excellent moderation of this event, and many thanks to each of our esteemed panelists, health authorities, and colleagues and friends for participating in this webinar and sharing your reflection. I would like to take a moment to congratulate the work of the 9 Caribbean countries that have successfully completed the essential public health function evaluation and are now actively implementing their funding. This morning, we gained relevant insights into strengthening essential public health functions in the regions, not just in the Caribbean. The lessons learned and the various paths forward discussed here are instrumental in helping to guide future actions. Let me be clear: improving capacities for essential public health functions provide a practical pathway to building resilient health systems. Therefore, the dialogue initiative today should not end here. A crucial next step is to maintain this momentum in evaluating and strengthening public health functions, increasing intersectoral stakeholder engagement as we continue to enhance capacities and translate the primary healthcare approach from concept to reality. I want to invite you all to continue engage across different platforms and networks, such as the Economic and Health Dialogue of the American, as well as to continue your support the strategy for strengthening the essential public health function to accelerate health system transformation 2024-2034 that will be discussed in the next Directing Council shut in a few weeks. By prioritizing essential public health function and advocating for primary health care, we can build a healthier and more equitable future for all. Thank you once again to everyone for joining us. We look forward to seeing you at our next webinar on September 25th as we celebrate World Patient Safety Day. Thank you again.
Thank you, Ernesto, and thanks for all for connecting and participating in this webinar. I think we made it very efficient in time. So thanks for your participation and hope to see you in the next webinar. Okay, bye-bye.
Thank you, thank you.
Bye, everyone.
Hi.